What is liver cancer? Liver is the largest internal body organ. It plays a key role in food digestion, energy storage, and detoxification. Cancer begins when healthy cells change and grow out of the control, forming a mass which is called tumor. There are basically two different types of liver cancers, primary and secondary. Primary cancers are those that develop from within the liver tissue, the most common of which is hepatocellular carcinoma. Secondary liver cancers actually arise from outside of the liver. They can also arise from colon, pancreas, stomach, breast, lung, etc. They are also called metastatic cancers. It is important to differentiate these two cancer types as the treatment will be different. Primary liver cancer is of different types, the most common of which is hepatocellular carcinoma. Other types of primary liver cancers are cholangiocarcinoma and angiosarcomas, but they are quite rare. Worldwide, liver cancer is the third leading cause of cancer deaths. In 2020, an estimated 8.3 lakh people around the world died of the liver cancer. For the people who are diagnosed with liver cancer at an early stage, the 5-year relative survival rate is 35%. If the cancer has spread to the surrounding tissues or organs and to the regional lymph nodes, the 5-year survival rate drops down to 13%. If the cancer has spread to a distant part of the body, the 5-year survival rate even narrows down to 3%. What are the causes of liver cancer? The following factors can raise a person's risk of developing hepatocellular carcinoma. Adult primary liver cancer occurs most often in patients over the age of 60 years. Men are more likely than women to develop liver cancer. Cirrhosis is the most commonest risk factor. Cirrhosis develops when liver cells are damaged and replaced by scar tissue. Most cirrhosis is caused by regular heavy drinking of alcohol. Other causes are non-alcoholic fatty liver disease, viral hepatitis, that is hepatitis B or C. Non-alcoholic fatty liver disease is a major risk factor which is caused by obesity and diabetes. Both of the condition increases fat deposition within the liver. Viral hepatitis is caused by viruses such as hepatitis B and C which infect the liver. Viral hepatitis was one of the largest risk factors of liver cancer worldwide. However, with the introduction of vaccine for hepatitis B, there has been reduction of cases of viral hepatitis B. The risk factors are cumulative. This means that having more than one risk factor increases a person's risk of developing liver cancer more. For instance, a person who carries both hepatitis B and hepatitis C has a higher risk than a person carrying only one type of virus. Similarly, a person with hepatitis C who also drinks alcohol has a higher risk. How to prevent liver cancer? Maintaining a good health can protect us from non-alcoholic fatty liver disease, such as maintaining a healthy weight, eating a balanced diet, and particularly doing a moderate physical activity. Hepatitis B can be prevented with the help of a vaccine that can be taken in the childhood. Vaccine is not available against hepatitis C. Cirrhosis can be prevented if the alcohol intake is stopped. Effective medicines are available for hepatitis B and hepatitis C. If you are already suffering from hepatitis or cirrhosis, meet your hepatologist for proper treatment. Screening for liver cancer. Screening is a process of detecting the cancer at a very early stage, even before it has produced any symptoms. Liver cancer screening is recommended only for patients with liver cirrhosis. The usual guideline for screening is to perform an ultrasound of the abdomen every 6 months to detect the development of tumor within the liver. A blood test called alpha-fetoprotein is also performed. If the level is elevated, then it may point towards presence of a tumor within the liver. In such a scenario, the doctor may ask for a CT scan or an MRI. The screening guidelines keep changing from time to time. So it is advisable that you meet your hepatologist for the latest recommendation for screening. What are the symptoms of liver cancer? Some of the common signs and symptoms of liver cancer are as follows. Pain, which is especially at the top right abdominal area near the right shoulder blade or in the back. Unexplained weight loss. A hard lump under the ribs on the right side of the body, which could be due to the primary tumor or a sign that liver has enlarged in size. Weakness or fatigue, yellowing of the skin or eyes, which is called jaundice. The symptoms that I described can be present in other diseases of the liver like hepatitis and cirrhosis. Diagnosis of liver cancer. Liver cancer is diagnosed with the help of a variety of tests. Whenever tumor is suspected in liver, based on an ultrasound report, the doctor will advise a CT scan or an MRI. The ideal test is MRI angiography. MRI angiography test will give following details like whether the tumor is present or not, or it is just a regenerative nodule in the cirrhotic patient. What is the number of the tumors, what is their size and the location, how is the quality of the rest of the liver, and what is the status of the veins of the liver. CT scan and MRI also helps us to grade the liver tumor as per the Lyrat's grading system. If the tumor is graded as Lyrat's 4 or 5, then it is definitely considered hepatocellular carcinoma. Certain tumor markers can also be helpful. They are measured with the blood test. Alpha-fetoprotein test is used for hepatocellular carcinoma. CA19-9 test is used for cholangiocarcinoma. Biopsy is usually not performed in hepatocellular carcinoma. It is only performed when the diagnosis is doubtful after the CT scan or an MRI. Treatment of liver cancer. In cancer care, different types of doctors often work together to create a patient's overall treatment plan that combines different types of treatments. This is called multidisciplinary team. HCC treatment, that is hepatocellular carcinoma treatment, it is planned based on following factors: size, location and number of the tumors, whether the tumor has spread beyond the liver, patient's general health, status of the remaining liver. The doctor will do chest CT scan to rule out any tumor deposits in the chest as a part of staging. When the tumor is small and liver function is good, then the best treatment is an operation to remove the tumor. If the size of the tumor is small and the number of tumors are less than 3, then in a cirrhotic patient, the ideal treatment is liver transplantation. If the tumor size is less than 4 cm, then the doctor may offer other treatment options such as radiofrequency ablation and microwave ablation. Here the tumor is burnt with the help of heat produced by various techniques, at the same time taking care not to damage the surrounding liver. They can be delivered through the skin, through the laparoscopic or open surgical method. When the tumor is large and operation is too risky, then the patient may be advised treatments such as chemoembolization or radioembolization. In these techniques, chemotherapy or radiotherapy is delivered directly into the artery supplying the tumor. Such technique do not completely cure the tumor, but they definitely reduce its size and growth. They are helpful in improving survival. They can be helpful while the patient is waiting for liver transplant. For those patients who cannot be treated by all the above methods, targeted therapy and immunotherapy are used. Targeted therapy such as bevacizumab, lenvatinib, sorafenib, and immunotherapy such as nivolumab and pembrolizumab are commonly used drugs in these settings. Hepatocellular carcinoma is a complex disease. There are many treatment options as per the various factors. Only your doctor can guide you for the best possible treatment.